हेलो दोस्तों, आज हम डिस्कस करने जा रहे हैं फेशियल नर्व के बारे में। कमिंग टू द कोर्स ऑफ फेशियल नर्व, द कोर्स ऑफ फेशियल नर्व इज डिवाइडेड इनटू द इंट्राक्रैनियल पार्ट एंड द एक्स्ट्राक्रैनियल पार्ट. द इंट्राक्रैनियल पार्ट it arises from the pontomedullary junction and then it takes a turn around the abducent nuclei and then it comes out of the pontomedullary junction and then it becomes the extracranial part. The extracranial part is divided into four parts: internal acoustic meatal part number 1, labyrinthine part number 2, horizontal part number 3, and vertical or the mastoid part number 4. And then it comes out of the base of the skull through the jugular foramen and it gives away the terminal branches. The branches of the facial nerve are as follows: greater superficial petrosal nerve number 1, then the nerve to the stapedius, chorda tympanic nerve, posterior auricular branch, nerve to the posterior belly of digastric, nerve to the stylohyoid, and then coming to the terminal branches, they are temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and the cervical branch. Coming to the significance of few of the branches, the greater superficial petrosal nerve, it supplies the secretomotor fibers to the lacrimal gland. Damage to the greater superficial petrosal nerve or the facial nerve palsy leads to a condition which is known as the dry eye. To test for the dry eye, the test used is Schimmer's test. Then coming to nerve to the stapedius, it is involved in the stapedial reflex. It protects us from loud sounds around 70 to 90 decibels. Loss of this reflex is seen in damage to the stapedial nerve or the facial nerve palsy. Posterior auricular branch, it supplies sensory supply to the posterior meatal wall. Loss of sensory supply of the posterior meatal wall is seen in the acoustic neuroma, which is known as Hitzelberg's sign. Chorda tympanic nerve, it supplies secretomotor fibers to the sublingual and the submandibular salivary glands and also taste sensation to the anterior part of tongue. Coming to the terminal branches, it can be remembered by the mnemonic 10 zebra bit my cat. T for temporal, Z for zygomatic, B for buccal, M for marginal mandibular branch, C for cervical branch. These all terminal branches supplies nerve to the facial muscles. Now coming to the causes of the facial nerve palsy, these are severe cold exposure number 1. Here we see the vasoconstriction, then rebound vasodilation occurs, then there is edema around the facial nerve which leads to the facial nerve compression and which ultimately leads to the facial nerve palsy. So the treatment for this is facial nerve decompression and the use of steroids. Coming to the next cause, which is Bell's palsy. Cause is unknown, diagnosed by the exclusion of all other causes, told that it is caused by the HSV infection and it affects the labyrinthine segment. Merkelson-Rosenthal syndrome. The cause is unknown here also. In this syndrome we have lip swelling, tongue fissure and the facial nerve palsy. Herpes zoster oticus. It is caused by herpes zoster virus. It leads to Ramsay-Hunt syndrome. It involves the geniculate ganglion. There are vesicles over the auditory canal and the pinna and there is facial nerve palsy. It can occur because of complication of ear surgeries like the stepidotomy and then mastoidectomy. Can occur because of fracture of the base of skull, acoustic neuroma and parotid surgeries. Coming to the complications of facial nerve palsy, these are dry eye. It is treated by lubricant drops which is methyl cellulose. It may lead to gustatory lacrimation which is also known as crocodile tears. It may also lead to gustatory sweating which is known as Fry's syndrome. Coming to the treatment of the facial nerve palsy, it includes use of steroids, acyclovir, facial nerve decompression, end-to-end anastomosis of the facial nerve, and cable grafting. Thank you.